Welcome to the fourth session of the E3 Equip webinar series. Before we get started, let's quickly go over a few housekeeping items. During the presentation, you're welcome to keep your camera turned off. However, during the Q&A portion, we would love it if you could turn your camera on so we can better connect with one another. A quick reminder that our E3 scholars have been sent a pre-session activity, so pre-session activities that are shared along with the webinar registration emails. And these short activities are designed to help you come prepared with questions, comments, or reflections for the speaker about the career being presented. So if possible, we strongly encourage you to take a few minutes to complete it ahead of time. We also encourage you to subscribe to the E3 YouTube channel, where you can find recordings of all our E3 Equip webinars. And so I am sharing the YouTube channel link in the chat. Do that right now. And you can go there and go through the previous webinars. And as we keep having webinars, they will be posted there probably about a week after the live webinar. Today, we are thrilled to welcome Dr. Hannah Wollenzien, Clinical Laboratory Director at the Sanford Medical Genetics Laboratory and Clinical Assistant Professor at the University of South Dakota, Sanford School of Medicine. Dr. Wollenzien earned her Ph.D. in genetics and molecular biology, focusing her research on how tumors develop and resist treatment. She also completed a clinical laboratory genetics and genomics fellowship at Virginia Commonwealth University Health System and is board eligible in 2025. Her research has been published in leading journals, including a feature on the cover of Molecular Cancer Research. She's also deeply involved in mentoring students and serving on national committees that advance genomics education and research. Outside the lab, Dr. Wollenzien is a passionate dancer and performer, actively involved in local dance companies and community theater. Please join me in giving a warm welcome to Dr. Wollenzien.
Thank you, everybody, for tuning into this session. My name is Hannah Wollenzien. I currently work as an assistant laboratory director for the genetics laboratory at Sanford Health in Sioux Falls, South Dakota. I'm here today to talk to you about all the different careers that are possible in a clinical genetics laboratory. I want to acknowledge my colleague, Debbie Figueroa, who lent me some of her slides from a previous talk. So some of these are hers and some of them are mine. So a kind acknowledgement to her for sharing those. So what does the genetics lab really do? What's the role of the genetics lab in the healthcare system? We really serve as the place that genetic testing happens. So for a number of reasons, someone may have genetic testing, and then the doctor or the physician assistant or the genetic counselor in the clinic will order testing. Those samples will come to the genetics lab where the testing is performed and the results are analyzed, a report is generated, and then that goes back to that provider that ordered the test. So commonly we see tests for people that are maybe having troubles with infertility and difficulty with conceiving. We also get a number of samples from children that have developmental delays, autism, or other behavioral findings. There's certainly a number of patients that have a family history of a genetic disorder that are looking to see if they're carriers for that disorder, or similarly a family history of cancer, so looking to see if they have some sort of underlying cancer predisposition syndrome. We do get samples from individuals that have pregnancies with some abnormal ultrasound findings or abnormal screening tests. And then finally, we get specimens from individuals with cancer, where we're actually testing the mutations of the cancer to see if there are some optimal therapies or clinical trials that individual would be eligible for. Testing in a medical genetics laboratory is oftentimes sort of split into two categories, either cytogenetic testing or molecular genetic testing. Cytogenetic testing I like to think of as the big changes, so whole chromosomes that are extra or missing, or big chunks of chromosomes that you can actually see under the microscope. So those would be things like karyotyping and FISH, the fluorescence in situ hybridization, as well as chromosomal microarray, which is looking for a little bit smaller changes, but still pretty big chunks of additional or missing information. Molecular genetic testing is really looking at a sequence based level, so looking for those individual mutations as opposed to those big changes. So we often do techniques like PCR, methylation assays. You can do single gene sequencing where you look at the sequence of just one gene, or big next generation sequencing panels where you're looking at multiple genes at a time or even the whole genome. And then I have methylation analysis on there again. I apologize for that typo. But really, we see patients or we get samples from patients from a very wide array of indications, which keeps things interesting. And we also use a very wide array of techniques, which also keeps things interesting in the genetics lab. So, what are some roles available in a clinical genetics laboratory? There's a whole host of roles that I'm going to go through today with different levels of education required for each role. These roles are clinical laboratory technologist or technician, a laboratory genetic counselor, variant analyst, clinical staff scientist, clinical laboratory director, which is the role that I'm in, and a molecular pathologist. There's a number of different job settings that clinical genetics labs are in. And this is certainly not exhaustive, but I work in a hospital-based setting, so these are large medical centers. Oftentimes in these settings, as a director, you'd have the least amount of research and teaching required. So really, it's more the clinical cases that are your focus. You could also work at an academic or university medical center. And so these can be interesting because you'll get a really wide variety of cases. People are coming to these medical centers oftentimes because they've been seen at other places and they haven't been able to find an answer for them, so they come to the university medical center. In addition, at these medical centers, oftentimes teaching is expected for laboratory directors, training of residents or fellows. Finally, many labs exist in private companies that you may have heard of. So an example would be something like LabCorp or GeneDx. And these are private companies where individuals can send their samples from all over the country or even the world for really specialized testing. So the benefits here are there's often a high case volume, which can keep things interesting. Some individuals in these labs have the ability to work remote, but oftentimes you're more focused on one test or one technique. So at these private companies, you may not be doing that huge range of different kinds of testing, but you're really focused on one or two different tests and techniques. The first role I'm going to talk about today is the clinical laboratory technologist or technician. So these are the individuals in the lab that are actually performing the test. So when the sample comes into the lab, they're scanning that specimen in, doing like the DNA or the RNA extraction, and actually performing the hands-on basis of the test. Generally, these roles require a bachelor's degree. Oftentimes, this degree should be in something like a life science, like biology. Some medical centers do require these individuals to have a medical laboratory science degree or an MLT. I also want to note that some states do require technologists and technicians to be licensed in that state. Speaking from South Dakota, which is where I live, we don't have a state requirement, but I know that there are some states out there that do. So if you're located somewhere else, and this is a job that you may want to pursue, certainly look into what the state actually requires for technologists or technicians in that state. In every lab in the hospital, every clinical lab employs laboratory technologists or technicians. So I have listed here a whole bunch of different kinds of roles that would be available to you. And then today we're really talking about a molecular biology technologist, who are those individuals in the medical genetics lab that are performing the testing. I wanted to give a little example of what the laboratory technologists at my lab do. So in the molecular lab, they would accession samples, so receiving those samples as they come in, scanning them into our electronic medical record, and making sure that that test is appropriate. They extract, they quantify, and normalize RNA and DNA, since we do both RNA-based testing and DNA-based testing, and then they store the samples as well. So we are required to hold on to specimens for a certain number of years, even after testing is done. And finally, they perform these high complexity tests like PCR things, Sanger, chromosomal microarray, or NGS testing. We also have technologists that are really specialized in cytogenetics. And so these are the individuals that are performing those cytogenetic testing. And this often involves growing the cells in culture, harvesting them, preparing microscope slides with all the chromosomes on there, and then staining those. And I have an example here of some chromosomes. So this is what it would actually look like under a microscope. These are real chromosomes. And so the cytogenetic technologists are the ones that are preparing these for analysis. They also do the analysis in our lab. So they assemble what's called a karyogram, where you line up all of the chromosomes in order. So here's chromosome 1, 2, 3, and so on. And then look for abnormalities in those chromosomes before the case comes to the director. If you're eagle-eyed, you may have spotted the abnormality in this case. So this case has 3 chromosome 21, which would be diagnostic for Down syndrome or trisomy 21. So the technologists serve a very, very important role in the day-to-day functioning and performance of these tests for us. The next role that I will discuss is the laboratory genetic counselor. So genetic counselors in general provide guidance related to genetic disorders. They can often work in a role where they talk about how a condition would affect an individual or a family. They interpret genetic test results. They aid in assessing the risk that a patient may or may not have a genetic disease. They help families make informed decisions about genetic testing and provide psychological counseling to help people adapt to a new condition or a new risk that they've just learned about. So in a clinic, clinics often employ genetic counselors that see patients every day and go through these types of things. Things like a pedigree. This is an example of a family tree where there's a high incidence of cancer in these individuals. So genetic counselors oftentimes work in a clinical setting that they actually see patients, counsel patients, and order testing. However, genetic counselors can also work in the laboratory. And this is another really important role for a medical genetics lab, where they're actually located within the laboratory and they aid in interpreting test results, answering questions from providers, and helping individuals to select appropriate tests. So they're a really important member of the care team, and they serve kind of as a liaison between the laboratory and the clinical team. Being a genetic counselor does require a master's degree in genetic counseling, and it is a board certified profession as well. Next role that some labs may or may not have is the genomic variant analyst. So these are individuals that spend most of their time interpreting and classifying genetic variants that have been identified in lab. So after sequencing, or really any test, but mostly after sequencing, the lab will have identified a mutation. And now, what do we do with that information, right? What does that mutation mean? Is it benign, meaning that this is something that's commonly seen in the population and it's not contributing to disease, or is it pathogenic, meaning that this mutation is affecting this individual in a way that puts them at risk for a genetic disorder? So these individuals spend a lot of time with the literature and databases and the genetic data to assess the variants and assign them a classification that we can then use to write a report and communicate those results back to the provider and to the patient. Oftentimes, these roles require a master's degree or a doctorate in genetics or microbiology or some sort of relevant field with several years of clinical research experience. So these individuals can have any master's degree. It doesn't have to be a genetic counseling master's degree. Could be something like biology, as well as some experience in a clinical lab or a genetic setting where they're doing things like this, assessing variants and using literature and databases. Another role in the genetics lab is on the research and development team. And these roles don't really have a standardized title, so you might see them as things like clinical laboratory scientist, R&D, which stands for research and development. Laboratory staff scientist is what they call them in our lab. But these are individuals that are responsible for developing and perfecting new laboratory tests. So as our patient population changes, as technology changes, we want to bring on new tests and offer new things in the lab. So these are the individuals that are working those new tests out that are saying, hey, we can sequence this or that, or I have a new idea for a test that I think would really serve our patient population well. So these individuals spend some time doing hands-on things in the lab, and they spend some time writing documents and writing new operating procedures for their new tests. So these individuals really get to become subject matter experts in the tests they develop. They get to dive really, really deep into these techniques and into these new tests, which is exciting for a lot of people. Oftentimes, these individuals have the opportunity to write papers on these new techniques or present posters at conferences talking about how they validated a new test and brought that up in their lab. Generally, these individuals will hold a master's degree or a PhD in really any sort of lab-based discipline, or they've had many, many years of experience in a clinical laboratory and they're really well-versed in these techniques and how to bring on new tests. I'm going to also spend a little bit of time talking about being a clinical laboratory director. So this is the role that I'm in, and we're in charge of interpreting clinical cytogenetic and molecular genetic tests that are relevant to the diagnosis and the management of human genetic disease. We act as consultants in laboratory diagnoses for a huge range of tests, really anything that the lab offers, we need to be able to consult with providers about. We also spend a lot of time with regulation. And so there are some regulatory bodies that govern clinical labs. And so it's the laboratory director's job to make sure that the lab is in compliance with regulation. Laboratory directors hold a doctoral degree. Generally, it's in something like genetics, and they have additional fellowship training. And we're board certified as well by the American Board of Medical Genetics and Genomics. So how do you become a lab director? Well, first you get a PhD. Some individuals that are lab directors have an MD degree or a DO, but oftentimes you get a PhD, and generally it should be in genetics or molecular biology or related field. After getting a PhD, oftentimes people will do a postdoc, so that's additional research training, or they'll do an industry job and get some experience working in a clinical lab, not as a director. And so the postdoc or the industry job to set yourself up for a fellowship really should be in a genetic setting, and ideally would involve clinical specimens. After completing your PhD and potentially doing a postdoc or an industry job, in order to become a laboratory director in a medical genetics lab, you'll have to do a fellowship in laboratory genetics and genomics. These fellowships most places are 2 years. There's a couple programs that are a little bit longer, but most places are 2 years, and they're accredited by the American College of Graduate Medical Education. In your fellowship, you learn the ins and outs of all different kinds of clinical genetics tests, how to interpret the results, what to do if something goes wrong in the test, the importance of all of these regulatory rules, and you really are being trained in how to become a lab director. I thought I'd offer a day in the life. And so every day for a lab director is a little bit different. Really, every week is different. But we spend a lot of our time reviewing cases, writing reports. So we get the results from the lab, we get the results from the genomic variant analyst, and then we write a report that goes back to the provider. Sometimes we'll call the provider if it's something that's particularly urgent, and we'll actually talk to them on the phone. But most of the time, we communicate via these reports that go back to the medical record. We also spend some time reviewing test appropriateness, so making sure that the provider has ordered the best test for that patient. We serve as a resource for the laboratory staff. So if something goes wrong, they come to us and try to troubleshoot with us and figure out, do we need to repeat this test, or is there some way that we can still use the data? We also spend a lot of time reviewing documentation and quality analysis to make sure our tests are performing as we need them to. And we also help with the development of new assays. Here at Sanford, we're lucky enough to have three clinical staff scientists whose job is developing new assays. But in some places, the lab director has a more hands-on role in developing new assays. I think it's a really fabulous job, but I have listed a few pros and cons here. If this is the career you're considering, it's something to think about. There's good working hours. It's rare that I work holidays or weekends. I enjoy that it's different every single day. It's very, very rewarding in that each test that comes through the lab is from a patient, and that individual is waiting for their results. That doctor is waiting for the results to make some medical decisions. And so it's really a rewarding career to know that every day when I come to the lab that I'm helping people. There's the opportunity to do research or teach if you want. So that's something that I enjoy. And so in my role, I'm able to do research. I'm able to teach residents, medical students, genetic counseling students, but that's not a requirement of the job. So if you're not so sure that you want to teach or do research, this could still be a job for you. In terms of the downsides of the job, really, sometimes it feels like there's a lot of juggling. The lab has a question, and you also have clinical cases that you need to sign out, but there's also some paperwork that you need to work on. So you have to be able to kind of change your hats and make sure that you're accomplishing everything that you need to do that day. It's a really great job. If you have other further questions about being a lab director, you're welcome to reach out to me or ask at another time. The last role I wanted to talk about in the clinical genetics lab is a molecular pathologist. So these individuals interpret molecular genetic tests in order to make a diagnosis. Similarly to a laboratory director, they write lab reports and communicate results with the provider, as well as participating in the regulatory review of the laboratory. These individuals hold a medical degree, so an MD or a DO, and then they did a pathology residency and a 1-year molecular genetic pathology fellowship in order to become a molecular pathologist in a medical genetics lab. So similar to a lab director, but taking a slightly different route into the lab and having more of that clinical training versus the lab training. If you are interested in a career in a genetics lab at any level, there's a few organizations that you should know about. So everyone here probably knows about ACMG. It's a wonderful professional organization that offers lots of conferences, courses, resources, and training, and it's free to join as a trainee. Another one I wanted to highlight that's free to join as a trainee is the Association for Molecular Pathology, which also offers things like conferences and courses and resources. And that one is also free to join as a trainee. I wanted to offer a case example so you can see how all of these different roles fit together in order to perform the testing and find an answer for the patient. So this example is a 3-month-old female. She was a product of an uncomplicated pregnancy, so mom had no troubles during pregnancy. Mom did have a cell-free fetal DNA screening, so that's a test that's performed before birth, where it's looking at the chromosomes of the baby to see if there's anything wrong. So this test did come back high risk for Turner syndrome, which is 45X, meaning that baby would be missing one copy of the X chromosome. This test is a screening test, so it's not perfect. So generally follow-up testing is recommended, but at the time of testing, that was declined. So once baby was born, there were some concerns for slow weight gain, some cardiac defects, as well as a ductus arteriolis, which is also cardiac defect. And so because of these concerns, the slow weight gain, the cardiac defects, a karyotype was ordered to look at all of the chromosomes of that baby. So before the sample even came to the lab, this individual likely saw a genetic provider, either a genetic counselor or a medical geneticist, that would have seen mom in clinic after that high-risk cell-free fetal DNA screening, and then that individual probably saw baby after birth due to their symptoms. So these are the people that ordered the genetic testing before the sample comes to the lab. So then the sample came to the lab, and the next person that got the sample was the laboratory technologist. So this individual received that sample into the lab and set up cultures on the baby's blood. So started growing the baby's blood. After a couple days, they harvested the cells and they prepared microscope slides with the chromosomes on the slides and looked at the slides under a microscope to prepare a karyogram and evaluate the cells that the baby has. In this case, in addition to doing a karyotype, we also did fish analysis. So the laboratory technologists also performed the fish test and evaluated the results. And what they found was there is an extra X chromosome in this individual. And so this is the karyotype, and so they have 2 copies of every chromosome except for X, where they have 3 normal appearing copies of the X chromosome. Similarly with the fish, the blue dot is the chromosome 18, which serves as the control. So we have 2 copies of chromosome 18, which is what you'd expect. And the green dot is the X chromosome. And so we see we have 3 copies of the X chromosome, which is consistent with what we saw in the karyotype. This is a little bit different of a view of fish, but we see here we have our 2 blue, so our 2 chromosome 18 serving as our control, and then our 3 green dots are 3 X chromosomes. So this baby ended up having, the results ended up looking like this, called 47XXX, which is what we saw in the karyotype. And then from the fish, we saw 3 signals from our X chromosome and 2 signals from our chromosome 18. So after the technologist prepares these results, the next person to get the case would be the clinical variant analyst. So this individual would then gather literature about 47XXX syndrome and start drafting a report discussing the result of this test. So what the clinical variant analyst might find is that 47XXX syndrome is somewhat common, with an incidence estimated to be about 1 in 1,000 births. There is some literature to suggest that this syndrome is underdiagnosed because there's often not a big phenotype here. Generally, those that have a phenotype, which means they have symptoms, have a lower birth rate, but then an increased childhood growth velocity. So they kind of catch up based on the birth rate. These individuals can have seizures, they can have kidney or renal abnormalities, as well as genital urinary abnormalities. Oftentimes they'll have premature ovarian failure, so some infertility later in life. They can have some behavioral problems, delayed language development, and challenges in school, issues with kind of fitting in and mood disorders. But studies have often found that the quality of life for these individuals increases after they're done with school. So this baby was referred for congenital heart disease. It's not a common feature in this syndrome, in 47XXX syndrome, but it has been reported a couple of times. So the clinical variant analyst would find all of this literature for us and summarize it into a report. Then the next person that gets the case would be the lab director. The lab director would review the data prepared by the laboratory technologists, look at those karyograms, look at the fish results, review the report and the literature that was identified by the variant analyst, and prepare a written report of what the results are. So in this case, they would say this baby has an extra copy of the X chromosome, which is diagnostic for 47XXX syndrome. And these are some things that you might be able to expect as phenotype or as symptoms as the baby ages. When the laboratory director is happy with the report, then they'll sign the results out to the patient's chart, where it'll go back to the doctor as well as to the family. In this case, we might have a laboratory genetic counselor follow up with the provider and discuss the results and tell them this is what we found, do you have any questions, and then recommend any potential follow-up testing that needs to be done as well. So I hope that illustrated that one simple sample coming through the lab really touches a lot of different aspects of the lab, and kind of everybody working in the lab works on every case to find the right answer for the patient and their family. I want to thank you for your attention. I think careers in a genetics lab are very rewarding. These individuals that are coming in seeking a genetic diagnosis are often on a long diagnostic journey. They've had lots of different tests, they've seen lots of different providers, and finally, they're being offered genetic testing. And so we have the unique opportunity of being able to find an answer for this individual. I want to stress that careers are available at many different education levels. You don't have to have an MD or a PhD to work in a clinical genetics lab. You can find a job with a bachelor's degree and have a really rewarding career. So please feel free to reach out to me. This is my email if you have any additional questions. Thank you for your time and attention.
Okay, that was a wonderful presentation. So many careers. So at this time, it would be great if everyone would be willing to show their video so that we can um, connect better.
Uh, Thank you for that presentation. I wanted to add, Dr. Uh, and I was there. One thing that you had mentioned with um, technology, folks that don't need to have a PhD to be able to work. I think that's a very good point because there's organizations like the ASCP, the Association of the American Society of Clinical Pathology, that can also offer up training if you wanted to become a technologist. I was a technologist in this area at one point, so I think that's another way to get into it on a bachelor's, and they have different routes. If you guys are interested in pursuing genetic technology as a program, as was mentioned, there are different avenues through the ASCP that you can pursue um, and work in a genetics lab. So, thank you for that.
Are there any questions about the presentation?
Yeah, I had a question. I'm unable to turn on my camera, but I was wondering, she mentioned like something about the different assays that she was developing, like they work to develop, and they have people assigned for that role. I was a bit more curious as to what exactly like are those assays they're developing.
Are you able to hear me?
Yes.
Okay, perfect. I was having some issues with my microphone. I don't know why my name is showing up as Yuka's name, so I apologize for that. Must be something weird with the Zoom link that I used. So we're always kind of constantly trying to sort of keep up with new technologies in the field and better serve our patient population. I can give you an example of a test that we just brought on board into the lab in the last month. So when patients are diagnosed with cancer, oftentimes the oncologists want to sequence the tumors and see what mutations are occurring in the tumors to see if there is a targeted therapy or a clinical trial that the patient is eligible for. And so before we had our test up and going, they would be sending these tests out to private companies. And that works fine. But what was happening for our population is that they're not able to integrate that information back into the medical record. As well as they have kind of a long turnaround time. They can be waiting up to a month to get their results. So we saw an opportunity to, if we developed our own sequencing assay that could be done here at the hospital, it would serve our patient population in the sense that they would be getting their results faster, and it would help our providers in the sense that those results would go right into the medical record instead of having to look at a PDF, which can sometimes be grainy, or if the patient moves, it can be hard to keep track of. So we worked for probably almost a year to develop this sequencing test in our lab. So when you develop a new test, oftentimes there's a vendor, there's a company out there that makes like a kit And you can buy the kit and then validate it in your own lab, make sure it works as intended, make sure that you get positive results when you're expecting positive results and negative results when you're expecting negative results, testing all your different sample types that you might expect to get. So if you're going to test blood and bone marrow, you want to make sure that the test works for both of those things. And then there's often lots of IT components working with your LIMS or your laboratory management system, so tracking how the samples move through the lab and calculations, dilutions, things like that. You also have to make sure that you make sure that those work in your hands. And then we do lots of provider education and say, hey, we're bringing up this new test. I hope you consider ordering it from us. Here's the advantage over how you would currently order it. So really, we kind of see a need. Generally, we approach it in the sense of what are the things that are being sent out of the healthcare system pretty frequently, and are those things that we have the expertise to be able to do in house and provide an additional benefit to the patient and the provider.
Thank you. That I was like I was that kind of helps me understand a little more about what exactly like how your role kind of fits into it. And then so now like you've developed this new assay, does that mean that you're still partnering with the same organizations or how does that affect kind of your work?
Yeah, so it means that in our lab at the hospital, it's one more test that we can offer. So working in a hospital setting, I kind of do everything that we offer at least. And so instead of people having to send a sample out to a private company, now they can keep that sample and keep that information internal within the hospital system. So it means that my life gets a little bit busier because I have more data to interpret and more things to sign out. But that's my favorite part of the job. So I'm always happy about having more things to sign out.
Thank you.
Really great questions. I was curious about the genetic counselor and how does that fit in with, could you explain a little more about how they work within the lab?
Yeah. So the lab genetic counselor is a really important role within the lab. And they kind of do a variety of things. So we have ours do quite a bit of test appropriateness. So when we receive a test in the lab, they'll do a chart review to make sure that that was the best test for that patient. Occasionally, some providers, if they're not quite as familiar with genetic testing, they may choose a test that they think will work, but we actually have a test that would be better. And so the genetic counselor might review the order, review the patient's chart, and then maybe call the provider and say, hey, would you want this test instead? It could answer these questions in a better way. After we run the tests and we have the results, sometimes the genetic counselor will work kind of as a variant analyst, and they'll be the ones to go to the literature and find out what this result means. So some labs have the genetic counselor working in that type of role. And then also after testing, we put our phone number on every report. And so if the provider or even the patient has a question, they can call the lab. And it would be the genetic counselor that would be the one to answer those questions to talk about what does this result mean? Should this patient have additional testing? Should they be referred to a new specialist based on their diagnosis?
I really like how that ties into our last presentation, um, which was highlighting genetic counseling, but also what else you can do with genetic counseling beyond. I think that one was more like research, right? So it's really nice to see the variety of abilities.
Yeah. Genetic counselors can do a lot of things from working in the clinic and actually seeing patients every day to research to a role like a lab genetic counselor where they're kind of doing a few different things but not seeing patients every day.
Are there any other questions that we'd like to ask Dr. Wollenzien?
I have a quick one if no one else. Dr. Linda, you mentioned in your talk you're involved a little bit with like regulatory stuff. Do you do any work? Like, what kind of work do you do in that space?
Yeah, so clinical labs are governed by um, many rules and regulations. The one that we think about most often is CAP, or College of American Pathologists, certifies most clinical labs. And they have these big packets of all these different rules and things that we have to make sure are in place. So we're fortunate enough here in my lab that we have someone that we call a quality specialist who's really the expert in the regulations, but it is up to the lab director to know that we're checking quality control. So every time you run an assay, you want to make sure that you have controls. The assay is performing as you expect it to, looking at trends over time, making sure that nothing in the lab is expired, making sure that everybody is following the standard operating procedures every single time that they run a test. And then we also prepare for inspections. So the lab is inspected every other year by a team that comes to the lab and makes sure that we're in concordance with all of those rules and regulations. So before an inspection, the lab director does a lot of document review and making sure that we're tracking and documenting everything that we need to do.
Thank you. Thanks.
I had another question. If you were to like, I guess for yourself, right? I understand you just sat for the boards. Congratulations.
Thank you.
Um, and just in general, about how many years would you say, in terms of education and training, does it
Yeah.
take to be a director?
So to be a lab director, I got an undergraduate degree, which took 4 years. And then I did my PhD, and it took me five, which is pretty typical for genetics or molecular biology, typically 4 to 6 years for the PhD. Then I did not do a postdoc. I went right into my fellowship. So it's very, very common for people to do postdocs. I know some people that have done a research postdoc for 10 years before they do a fellowship. But for me, I went straight from my PhD into my fellowship. And my fellowship was 2 years long. And then I started working right away as a lab director. So I've been working in my role for a year, and I just took my boards last week. They were offered every other year when I finished fellowship, so I was on the off year, the year that they weren't offered. But now those boards are every year. So someone entering the field now would be able to take their boards right at the end of the fellowship instead of having that kind of 1 year gap. So education, I had the 4 years of undergrad, 5 years of PhD, 2 years of fellowship, which comes to how many is that? Like 10, 11. And then technically 1 year of working, but still studying for boards. So I suppose we can count that as well.
Yeah. So thank you for sharing that. And I think an interesting thing about in general about the careers in this field is that it sounds like a lot, right? But the reality is that, at least in my perspective, the years will go by anyway, and it's not, and you're still really young, right? So,
Yeah.
um, so sometimes I know I've spoken with students, college students, high school students about how they are looking at medical fields or genetic fields or PhDs, and they're like, that's such a long, road. And, I always like to say, well, the years you're still going to be doing something, right? You're still going
Yes.
to be doing something every single one of those years, right? So it's okay, don't focus on the amount of years, right? So I kind of wanted you to share the years, just to to go back to the idea that it doesn't mean that that it's actually a long time, because it isn't. Time just keeps going anyway. So you got to do what you love.
Yeah.
And
Yeah. Absolutely. I think that's a really good point. It seems like a lot, and what I tell people is just kind of focus on the step that you're in now. That it's great to have a goal. It's great to have a career that you really want to have and that you're working towards. But when you're in college, focus on being in college. Then when you're in grad school, focus on being in graduate school. You don't have to be so into that final career that you don't get to enjoy what you're doing right now, because it is fun, and it is a long journey, but I've enjoyed it, and each step that took me closer to my career I liked better and better because I got more and more focused on what I really love to do.
thank you for sharing. Are there any other questions from our students? Okay. Well, I definitely do not want to keep you for the full hour. There's some more questions. Today we are small but mighty. I was sharing with Cynthia when we first got on the call that I was um, I was thinking this one will be there will be less of us just because I know a lot are this is like end of summer, a lot of people are on vacation and so forth. And I'm just very grateful for all of you and for Dr. Wollenzien to be able to do this webinar for us and to share her time and her experience and the career, her path in the career. This webinar is being recorded, and so it will be posted on our YouTube channel. And so, I encourage that you share it with whoever's not available right now or whoever's not able to be here right now. With that, I'd like to just say thank you for joining today, and thank you for your time, Dr. Wollenzien. Thank you for all of you for being on the call, and we look forward to seeing you in September, where we will be talking more about research in specifically how does, what is it like, what to have a life of a medical geneticist researcher and balance, your life outside of the job. So that will be the focus of our next webinar. Have a wonderful evening and a great weekend, and we look forward to seeing you next time.
Thank you.
Thank you.